Hi guys, welcome to today's presentation. Thank you so much for those of us who are watching for the first time, those who've been commenting, those of us who've been reaching out to me through various social media platforms. I believe we've had some wonderful discussions and I think a bit of an understanding what it means to be trained in nursing, what it is to be a nurse, and some of those hard decisions or hard questions that you have, we can be able to discuss and see what's the way forward. I'm happy that most of us that have been following have already joined the nursing training, not only in KMTC, but in mission institutions, in private institutions, and even for other ministries. Basically, the essence is that you're being trained to be a nurse. So really, it doesn't matter so much which training you go to, because all of these training institutions have been regulated or have been approved by the Nursing Council of Kenya. So at the end of the day, you will still get a license. It doesn't matter whether you trained in KMTC, whether you trained in a private or a mission institution. What really matters is the effort that you put in so that at the end of 3 years, you're a competent nurse. So I'm going to very briefly share with us the structure of the nursing program, because some of us had a few questions here and there. They really wanted to know how is it like for the program for the 3 years. So I'm going to share with us a basic structure so that we have an understanding. If there are questions that will come up, feel free to ask, to reach out, and I'll be able to answer us. So our focus will be on the KRCHN program, which is a diploma in nursing program. It's one of the diploma programs in nursing. We have KRCHN, we have KRN, we have KRN midwifery, we have KRN mental health and psychiatry. But today I'm going to focus on the KRCHN program, because most of the people that follow, or most of the people that ask questions, this is the program that they chose, and this is the program that they're being trained on. But should you have questions for the other type of nursing program, please feel free to reach out and I'll be able to share with you or to answer some of the questions that you may have. So on the program outline, we know basically the course takes 3 years. Initially it used to be 3.5 years, but the curriculum was reviewed by the Nursing Council of Kenya, and they wanted it to be in line with all the diploma training, so that now so long as it's a diploma training, it takes 3 years. Translated into weeks, that is 156 weeks. That is very important, because this counting of weeks or years ideally starts from your first day of the nursing training. So if your admission letter said you report on 5th April, for instance, it means that from that 5th April is your day 1 of the nursing training. So you can calculate from the first week of nursing training, that is from the week that has 5th April, up to the 156th week, so that you're able to see and gauge by when should you be finishing up your program. 3 years may sound quite a long time, but if you speak or you talk to those of us who are already in training, you may realize that 3 years is a very short time, because the content is so much, the expectation is so much, the scope is wide. So you find the 3 years is a very little time compared to what is expected of. So, and out of the 3 years, aspects that you're going to be taken through in your training, we have the theoretical experiences, or what we call theory, the theory sessions. This is where you are in class for the lectures, and then that would take 40 weeks, translated to about 10 months. And then you can see the rest of the weeks or the rest of the months is purely on nursing experiences. So then therefore the rest of the time, that is the minimum clinical nursing experiences, will take 104 weeks. So you can be able to see for the diploma in nursing training, there is more emphasis on the clinical aspect. There's more emphasis on the clinical experiences, which takes up the bulk of the work, that is 104 weeks, compared to the theory sessions that would only take 40 weeks. That doesn't mean that the theory sessions minimal in nature. No, actually the content is so much compared to the 40 weeks that has been allocated. So there's going to be a lot of work coverage, theoretical coverage within the 40 weeks. And then, of course, now you'll be exposed to the clinical experiences that would take about 104 weeks. So you can be able to see it is the minimum, meaning it can go beyond. It can go beyond the 104 weeks because this is only what the Nursing Council has outlined in their syllabus. So you have different institutions, because remember I said there are categories of institutions that train. We have the government-owned, we have the private-owned, we have the mission and other ministries. They'll each individually come up with their own curriculums. So you may find the curriculum for KMTC may not be a duplicate as the curriculum for maybe Mater Hospital, may not be the same curriculum for Nairobi Women's, for Nairobi Hospital, for St. Francis, Nazareth, Kijabe. It will be different because different curriculums are structured to cater for different needs that these institutions anticipate. So you may find one institution, it will take 104 weeks. In other institutions, it will take more to break down these clinical nursing experiences so that you're able to see which specific experiences are these and the weeks allocated to each one of them. Remember, I said this is a guideline given by the Nursing Council of Kenya, and different institutions will be able to now break them down so long as they're able to meet what the syllabus entails. So the clinical nursing experiences, we have experiences in the community health nursing. When you refer to as community health nursing, this is basically the public health aspect of it, where you go to the community, you work with the community, the maternal and child health, rural experiences, district experiences, all that should be able to cover minimum of 22 weeks. We have the midwifery aspect of it. We would be able to cover 26 weeks, and midwifery, here we're talking about from conception, so it cuts across. So in midwifery, we have the mother and the child. So issues to do with delivery, issues to do with the neonate or the child is covered within the midwifery aspect of it, and that is 26 weeks. Then we have the medical nursing. This is purely the medical conditions, whereby you'll be exposed to the medical wards, purely medical wards, and this can be either the female, male, or the pediatric medical wards. It is meant to be to be covered within 12 weeks minimum. It could be more than that, but at least minimum, any student who needs to train must be able to should have covered at least a baseline of 12 weeks. We have pediatric nursing, that would be 10 weeks minimum. We have surgical nursing. So surgical, again, it could be gynecological, it could be orthopedics, it could be just purely surgical ward. Minimum of 12 weeks is what is expected of you. And then we have now the theatre, which is 4 weeks minimum. But you find most institutions would put it at maybe 6 weeks, so that to enable students gain more experience when it comes to operating theatre. The reason is some of these areas, we call them special areas. From theatre going forward, these are special areas. The students are exposed in this area so that when you qualify, sometimes you may be deployed in this department, or you may have an interest. Maybe you may want to be a theatre nurse, you want to be a scrub nurse, you may want to be an aesthetic nurse. So you are given just a basic foundation of what it entails and the scope, the minimum scope, so that if you develop an interest in this area, you can later specialize on the same. Other selected or special areas is the casualty and OPD. Majorly refers to A&E, accident and emergency, or just emergency. It is meant to be covered within 6 weeks. Then we have psychiatry nursing, 6 weeks rotation or clinical experience, but you find most institutions may put it at 8 weeks. But what the Nursing Council recommends is that you must at least have a minimum of 6 weeks exposure. Then we have other selected experiences. So others we may look at, maybe these are the special clinics. The special clinics could be like the eye clinic, or what we refer to as ophthalmology clinic, could be the ENT clinics, could be the diabetic clinic, could be the surgical outpatient clinics, could be the nutrition clinic. So those are selected experiences whereby you find, as I mentioned again, different institutions based on what the curriculum they have, they may be able to be exposed in these selected experiences. So you may find a student being trained in one institution and they'll be exposed to ophthalmology, ENT, dental, whereas others may not. Others may be exposed to, maybe like those who may train in Nairobi Women's, they'll be exposed to GVRC, Gender Violence Recovery Center. Those now fall under selected experiences. So now a student is just basically exposed to this, we call them special clinics, so that if you develop an interest, you may want to further specialize on the area. And again, this experiences enables you to properly understand what is covered from the theory aspect, because some of these things are covered from a theoretical aspect of it in class, and now you are exposed to the clinical experiences, so that now you are able to merge the two, the theory and the clinical aspect of it. So in a nutshell, that is what is expected in the clinical experiences. I should be in a position to, maybe if we want, you can comment, for me to now break down the theoretical experiences. What that means is that what are you supposed to cover in your first year? What are you supposed to cover in your second year? And basically in your third year. Again, I need to mention that for the theory, different institutions, either they having what you call the block system or they have the semester system. So you find for those institutions that have the semester system, they either have first and second semester, they have 2 semesters in a year, as opposed to the block system. The block system goes up to the 6th block. Whereas in the institutions that have the semester system, for every year they only have they only have 2 semesters, first semester and second semester. So if you would be interested in the further breakdown of the semesters or further breakdown of the theoretical experiences, feel free to either side chat, feel free to comment, feel free to just interact through Facebook or Instagram, and then I'll be able to present or to share some information on the breakdown of theoretical experiences. In our next presentation, I suppose maybe I will talk about the evaluation system. Now that we know the theory covers 40 weeks, the clinical experiences cover 104 weeks, we are going to look at now what is the evaluation system when it comes to the nursing training. Thank you so much for watching. Thank you so much for subscribing. Thank you so much even for reaching out to ask questions. I'm happy that most of us are interested to know more and are interested to just to understand what it is or what it means to be trained as a nurse. Feel free to like, you can share, you can subscribe, so that you can be able to get more content and you're alerted whenever I've uploaded new videos.